As they did with immigration, the UK government is creating a hostile atmosphere for those that are signed off on long-term sick leave, blame and shame. With unemployment low and shortages in the UK labour market, concerns have been expressed at the level of UK economic inactivity, people of working age that are no longer in the labour market. There's a particular focus on long-term sick leave. Back in the autumn, the Prime Minister called it a national scandal that so many people of working age are incapable of working. He pointed out that in 2011, 1 in 5 of those doing a work capability assessment were deemed unfit to work. He says it's now 65%. Are people 3 times sicker than they were a decade ago, he asks? No, of course not. This has been repeated a number of times, including in a recent article written by the Secretary of State for Work and Pensions, Mel Stride, on the new government's plan to get people who are on long-term sick leave back into work. The Secretary of State repeats what Sunak said. It's wrong that the proportion of benefit claimants on the highest tier of incapacity benefits has trebled over the last decade. He also says, nor is it right that people with milder mental health conditions should be automatically parked on long-term sickness benefits and left alone. That it's wrong that fit and able claimants are allowed to remain on benefits for lengthy periods without bothering to engage with the job centre. So the government has a plan. It's reforming the work capability assessment with the aim of reducing the number of people signed off by 371,000, making a saving of £3 billion over the next Parliament. And it's backed up by the threat of tough new sanctions for those that refuse to engage. Of course, supporting people who are unwell to get their lives back together is a good thing. People who are off work sick should certainly be given support in order to maximise opportunities to get back into work. However, this plan has more hostile motives than just trying to help people that are unable to work due to sickness. There's an implicit assumption here that it can't possibly be right that there are this many people unable to work due to sickness. There's also a minimising of mental health issues by implying that people with milder mental health conditions are automatically parked on benefits, and there's an accusation that people aren't bothering to engage with the job centre. Why are they doing this? I think the answer is that it's conservative neoliberal ideology, the view that too many people on benefits is a bad thing. If the system wasn't so generous, people would go back to work. People are just too comfortable on benefits. If necessary, we'll cut people's benefits if they don't make more effort to find work. So much of this is based on assumption and ideology. The question that no one has addressed is, what if this many people really are sick? And what are these accusations and insinuations doing to those who are really worried about whether they're going to lose their benefits? If someone is signed off work that actually is capable of working, nobody would be against them being encouraged to go back to work and having their benefits stopped. However, my gut feeling is that if there are cases like this, they're in a minority. Let's just look at the numbers, some cold hard facts. This graph provides a breakdown of the causes of economic inactivity. We see that it's true that for those that are economically inactive, there's been an increase in the percentage that are long-term sick, the yellow line. So it's a fact that there's been an increase in the number of people that have left the labour force due to long-term sickness. However, I'm struggling to see that the number of people long-term sick has trebled in the past decade. We can see that over the past 10 years, the increase in long-term sick is around 800,000 people. It increased from 2 million in 2013 to 2.8 million in December 23. Although this is quite a big jump, 40%, it's not triple, which would be 300%. We can also note that the increase isn't really over the past 10 years. Most of the increase has in fact come over the past 4 years since COVID, 700,000 people. So where does the tripling claim come from? Sunak said that the number of people being found unfit for work has gone up from 20% in 2011 to 65%. I can't find exactly where he gets this information. I did find work capability assessment outcomes from the DWP database. The main long-term sick category shown by the blue line is the so-called support group outcome. This shows that there's been a significant increase from around 33% in 2011 to 65% in early 2023. This still doesn't back up Sunak's claim. It's doubled since 2011, not tripled. Although there clearly is a question worth looking at here, why has it increased like this? This data is not sufficiently reliable for the government to be making such bold claims about how many people are actually unable to work. These are monthly assessments, these aren't total numbers. Thus, it's not really telling us anything about the overall levels. It doesn't tell us anything about the duration of the sickness, for example. The graph we saw earlier are total numbers, so this is a better indication of the trend, i.e. increasing by 40% to 2.8 million. There's absolutely no evidence of a trebling. Two obvious factors are at play here. First, we suffered the worst pandemic in living history. Isn't it possible that COVID and long COVID accounts for a large proportion of this increase? Secondly, as a result of austerity and the starving of funds for the NHS, massively increased waiting lists are delaying medical care. This is also a possible explanation for the increased long-term sickness. If people had better access to healthcare, they might not have to leave the workforce. This is only anecdotal, but I personally know a few people who've gone through these work capability assessments. My impression from speaking with them is that the assessments are really tough and they're stressful for those that are genuinely unable to work due to the fear that their benefits are going to be cut. There are various stories that have been reported in the press that back up this anecdotal evidence. The most extreme was the case of Stephen Smith, the 64-year-old man who was declared fit to work despite the fact that he weighed 6 stone due to lung disease and osteoarthritis. His benefits were stopped, but he appealed and won his case at a tribunal and then died a few months later. The other point to make here is that, as with the case of immigration, the government is making more scapegoats. Back in 2012, disability charities were already raising concern that the focus on alleged fraud and overclaiming to justify cuts in disability benefits caused an increase in resentment and abuse directed at disabled people, being labelled as scroungers. This is 2 years into the Tory government, when the effects of austerity were really being felt in public services and benefits. The Tories were already making it much more difficult to be signed off long-term sick 10 years ago. There has been a significant increase in those unable to work due to long-term sickness. However, the government's oversimplistic assumptions that allow them to blame the high number on the fact that they're not really sick is upsetting, offensive, and really damaging. Rather than focusing on their own failings with the health service and the dramatic impact of COVID, it's politically useful to blame the sick. This is nothing short of a disgrace. I hope you found this information useful. If you did, please consider liking and subscribing. I'd really appreciate that. Thanks for watching, and I'll see you next time.